Hello, it is so very nice to see you. My name is Lee and I am the one who's going to be doing your cranial nerve assessment here at the ASMR clinic. How are you doing today? Awesome. And just to make sure I have the right patient, do you mind confirming your first, last name, and date of birth? Okay. Awesome. And this looks like, is this your first cranial nerve examination, or you think you may have had one before? Okay. Now, I just have a few questions to ask you, just so we have general information on you as a patient. Do you have any medical conditions I should be aware of? Are you on any medications at all? Awesome. Any surgeries? And how old were you? Okay, and then do you smoke or drink or use any recreational drugs? Alrighty. And are you allergic to absolutely anything? We will be testing various senses today, so I just want to make sure you're not allergic to anything. Not that you know of. That is fantastic. That's great. Oh yeah, no, it'll definitely be super fun. You know, at this ASMR clinic, we have me, Lee, and then we have Leanna, the PA. And I kind of like to make things a little bit more fun, straightforward, to the point, not so serious. You know what I mean? Yes, I'm kind of a bit goofier if I have the energy. But I will tell you, your girl is caffeinated. So this is going to be, it's going to be fine. So don't even be nervous. I guess I should probably ask you, are you having concerns with regards to this cranial nerve exam? Are we doing it for, you know, concern for one of them not being normal, or not at all? Good. That makes them so much more enjoyable. All right, well, let me put some hand sanitizer on, let me put some gloves on, and then we will get started with this examination. I'm going to keep this clipboard on me here, though, because we will need it just to kind of keep track of everything. Do you know roughly how tall you are and your weight? Okay. Very good. Okay, so I'm going to put some gloves on here. How is your year going so far? Everything going okay? Yeah, mine as well. Thank you for asking. Alrighty. Are we ready to get started? Cool. And of course, you know, I'm like a sister to you. So with that being said, if you ever get uncomfortable or you just feel sick for whatever reason, just let me know. Awesome, awesome, awesome. Okay. Are we ready? Cranial nerve 1 is what we call the olfactory nerve. And so this is essentially testing your sense of smell, okay? So what I'm going to do is I am going to basically be grabbing my little perfume container here. And these perfumes carry various different scents. I will not tell you if you're right or wrong, but I just want you to let me know what you think these smell like. Now, there are no identifiers on here, so I guess you could just keep your eyes open because it's not like you'll know by looking at it. They've done a pretty good job at making these scents very distinct. So, with that being said, you're just going to be taking a good deep breath in, and then we'll kind of take it from there. You let me know what it smells like. Yes. Okay. All right. Scent number 1. There you go. Take a good whiff of that. What are we thinking? You let me know if if you have to smell it again. You do? That's okay. What does that smell like? Interesting. Okay, thank you for your input. We've got set number 2. Okay, take a smell. One more smell. What does this one smell like to you? Okay. Would you consider yourself as being someone that has a good sense of smell? Well, I guess you'll find out at the end now, won't you? All right. Smell that one there. And knowing you, let's just sniff it again. There you go. What do we think about that one? It is a little bit trickier, I will give you that. Interesting. Okay. We've got 2 more left here. All right. Take a good whiff of this one. And then again, just for you. There you go. What do we think of that one? Good. Last one here. Okay. Let's activate that a little bit. What about that one? Okay. And are those your final answers? You passed. You got them all right. I always like to make people think they didn't. All right. Great job. Great way to start with that first cranial nerve. All right. Next one is your optic nerve, which assesses vision or like visual changes. Do you wear contacts or glasses at all? Okay. And have you noticed any changes in your vision? Okay, just making sure. Do you mind reading these first 2 numbers here? 9 and 5. Very good. We are going to skip and kind of go over to this line here. Can you read that for me? 2, 8, 4, 3. Very good. What about this line here? Definitely a little bit harder. 7, 4, 5. Great, excellent. What about this one? 6, 3, 9, 2. Very good. No, that was really good. Great job. Alrighty. Cranial nerve 3. You are going to find that there's quite a few cranial nerves that have a lot to do with our eye movements and vision and that sort of thing. So if some of these seem repetitive, they seem repetitive to me as well. Cranial nerve 3 is the ocular motor nerve. This is kind of where we assess your pupils as far as reactivity and constriction. So I'm basically just going to be having you look at a pen light, okay? Yeah. Not much you have to do on your end by any means. So if you wouldn't mind staring right at my finger here, I'm just going to take a look at both eyes. Sorry if our neighbors are noisy. They're not the most respective of the ASMR environment. I'm just kidding. They forget a lot. Okay. Very good. Pen light on, off, on, off. Pen light on, off. Very good. All right. Pupils are reactive, reassuring. Let's see, cranial nerve, the 4th one, the trochlear. Looks like you were just going to follow my finger for that one. All right. You're just going to follow my finger. Don't move your head. There you go. Good. Excellent. Very good eye tracking. Good, good. Okay. The fifth cranial nerve, the trigeminal nerve, we're going to be assessing functions of the face, sensation, making sure you feel in certain areas of your face, the reflex of like your cornea, and then just kind of soft versus sharp, okay? Yeah, you already know I'll walk you through the whole thing here, nothing to be nervous about. So, first thing is let's do corneal reflex and sensation. So this cotton swab I'm going to bring kind of close to the corner of your eye here, okay? Good, blink. Perfect. And then I just need you to close your eyes for me. And then let me know when you feel something and aware. It would help if I didn't drop the swab. Good. 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 Excellent. So, there is going to be certain sensations that we have to distinguish in our face. This is going to feel like the dull. Okay, and this one, as you can see, it's a pointier end, is going to feel like the sharp. And so what I need you to do is close your eyes and let me know if you feel a sharp or dull sensation. Very, very good. All right. I think we've assessed enough function of that cranial nerve, if you ask me. You can do like so many different things with that one, I gotta tell you. All right, cranial nerve 6, the abducens. This one is also just going to be following the pen light here. Do not move your head. Kind of seeing if both eyes are reactive equivalently. What did I just say? Basically, they're both doing the same exact thing, and one isn't sort of, not functioning as well as the other. A lot of it is like muscular innervation of the eye, I feel like. Eyes are a very important organ, so I've realized with time. Yeah, very complex, so many things go into eyes. All right. Next up, cranial nerve 7 is the facial nerve, one of my favorites. Do you mind smiling for me? Can you frown? What about raising your eyebrows? Good, very good. Can you puff your cheeks? Okay, good. And then lastly, I just need you to identify certain tastes, whether it's bitter, salty, sweet, sour. So I'm gonna give you 4. It's either gonna be bitter, salty, sweet, or sour. And I need you to tell me which of it is to see if you're able to identify different tastes on the tongue. Sound straightforward? Good. So let me grab that here for us then. Awesome. Okay. can you stick out your tongue? This is just going to dissolve. What does that one taste like? That one's sour. Very good. Okay, what about this one? Salty. Excellent. And what about this one? Okay. Not going to tell you if that's right since we only have one more and I want you to be sure. What about this? Yes, that final one was bitter. Good. Very good. Let me close up this exploration kit here. This has been really fun. I've loved working with this. Okay. Awesome. Next up is cranial nerve 8, which works a lot with our hearing. So I have a tuning fork here, and you are just going to close your eyes, and you are going to let me know which ear you hear a sound coming from, as well as when that sound stops. Seem pretty straightforward? Good. Close your eyes. Good. Good. Very good. Excellent. Good. You're doing great. Awesome. Last one. Yes, you know I had to mess with you in that last one. I'm just making sure. All right. Very good. You're doing great on this testing here so far. Cranial nerve 9. Can you say ah for me? Yes, this is more so with tongue. Gonna have to assess gag reflex. I am so sorry. I know this isn't comfortable, but I promise I'll get it done super quick. Okay, real quick, I promise. Don't mind me. Okay, say ah. There you go. Quick wipe, 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 wipe. Yes, you do have a reflex. Do you mean do it again? Just kidding. I used to hate getting those done as a kid with like strep throat swabs and stuff. It was the anticipation. It was the worst. The absolute worst. Yeah, no, you're telling me. All right. Cranial nerve 10, vagus. Can you swallow for me? Very good. Can you say your first last name and tell me one fun fact about yourself? You could say it in the comments. Very good. And believe it or not, that is how we assess for cranial nerve 10. Now, cranial nerve 11. Can you shrug your shoulders for me? Yep, just like this. Now I'm going to put my hands on top. Can you shrug them again? All right, and I'm going to place my hand on the side of your face here. Push against my hand. Push, push, push. Okay, this side now. Push, push, push. Very good. Last cranial nerve, hypoglossal. Can you stick out your tongue? There you go. Can you move it side to side, up and down? You did it. You finished all of the cranial nerves. Isn't that such a way to end an exam? Yeah, looking a little bit silly, am I right? All right, well, you did absolutely fantastic on this cranial nerve exam. You absolutely killed it. So with that being said, I'm going to input all of your results. You'll be able, and so will your providers, your specialty providers will be able to see it in your chart. But you did absolutely fantastic. You passed with flying colors, no deficiencies that we would want to be concerned about or need to send you to a specialist for. How was your experience with this cranial nerve exam? Good, yeah, no, my job is to make them fun, so you don't feel like you're going to the doctor, you know what I mean? No, yeah, it was super fun. Of course, you know, you can get these yearly if you so choose to, but my job is done. If you need anything from me, let me know. Otherwise, I have a little break till my next patient, so I'm gonna go take a break. But you please enjoy the rest of your day. You did awesome on your cranial nerve exam today, and if you would like to come back for another one, feel free to schedule another appointment with me. Absolutely. Well, I hope you have the most amazing day. Thank you. Bye-bye.